I was in Washington, D.C. last week. That town is absolutely still, despite the fact that this is now the law of the land, there's so much posturing going on up there, so much talk, so much demonstration. I saw no fewer than 3 panel trucks with all sorts of advertising, calling our leaders all sorts of interesting names, driving around Washington, D.C. I had breakfast at a place called Pete's Diner, which is a little dive, but I walked in with a lobbyist friend of mine, and I looked at the end of the counter I saw this gentleman that was characteristically very, very tanned, had dark hair. I heard him speaking, and he was speaking in a sort of a deep, gravelly voice. He had a baseball cap on, and he appeared to be weeping, and his shoulders were slumped. And so I walked over to him and turned around, and it was John Boehner. And I said, Leader Boehner, it's really nice to meet you. And he says, America's done. Life as we know it's over. We couldn't stop this. I just don't know what to do. And sort of we consoled him and went on. But I spoke on a panel with a gentleman from the Heritage Foundation, and it is to a group of physicians. And despite the fact that this is now the law of the land, this discussion is likely going to continue, for the next couple of years. The whole Republican response and this and that. But at the end of the day, John's right. This has been being talked about for 3 or 4 years. It's been on the agenda, and anything that stays on the front page of every newspaper in the civilized world for 3 years, sooner or later even a government's going to act. So that's what's happened. And so let's take a look a little bit at the Texas perspective on how this is likely going to affect us. So if you take a look at Texas, we're sort of first team all uninsured. 28% of Texans are uninsured. That's 6 million Texans. We lead the nation in that regard. And there are a variety of reasons for that we'll talk about. 30% of Harris County is uninsured. 26% of the state budget in Texas is spent on health care for the poor. That's largely Medicaid and that kind of thing. And I know your eyes roll. These numbers get really big and they roll off all of our tongues, but it is in fact a huge number. And I think for the first time certainly in my lifetime, these macro issues are going to come home to roost in individual ways, both in terms of business and in terms of each of our own individual lives. Texas is unique. Small businesses dominate our economy. Only 32% of the businesses with 50 or fewer employees offer insurance in Texas. And that's a huge part of our economy. In other states, those same businesses characterized as such provide 43% of their employees, 43% of those businesses cover their employees, and 53% nationally. So the concept of Texas being a rugged individualist state, take care of yourself, no one's going to take care of you if you don't, that kind of thing, it comes home to roost and is reflected in these very important demographic numbers. The biggest problem that we've had in Texas has to do with the surging population. We have the largest border with Mexico. We've had a huge influx. To say we've had a huge influx of immigrants is an understatement. Our state has been characterized as a low regulation, low tax state, no state income tax. It's been a great place to do business. It's a great climate. And so it's caused our population to surge by 14.3% since the year 2000, largely driven by immigrants. 56% of the births in Texas today, over half, are Medicaid, come to Medicaid families. Now, Medicaid is the state and federally co-opted program to take care of the poor and the young in our country. That's what makes up 26% of the total state budget. One out of every $4 that we generate goes to pay that. If you look at the demographic breakdown, 25% Anglo, 11% Black, and now almost 60% Hispanic in the Medicaid program. Demographically, and I'm no demographer, but even I can understand this. Between the years 2000 and 2014, when most of this legislation is going to be essentially made active, of the growth that's expected in our population, the demographic breakdown of that growth is as you see. Very anemic growth in the Anglo population, a little bit higher in the Black population, continued explosive growth in the Hispanic population in our state over really the next now 4 years. Where do the uninsured go? Where have they typically gone to receive their care? Those 6 million people in Texas, 6 million people. You look at, they go to the ERs. The ERs of hospitals have been their safety nets. ER visits have increased 18% nationally, but in Texas, they've increased by 33%, reflective and supporting the notion that we have such a relatively high percentage of our population without insurance. ER visits in Harris County up 33%. Half of the ER visits in Houston are primary care. They're not for people who were in a car wreck or had a heart attack or something like that, but rather had an infection, had an earache, had a child that was crying at night, or whatever. We've all been there, but that's where they go. And had they had some access, could have had that taken care of in a much more rational and effective location and lower cost. Let's talk a little bit about the impact of reform specifically in Texas. Virtually all Texans by 2014 will have coverage in this bill. That's the good news. Of the 6 million people, 1 million will be added to the Medicaid rolls. Today in Texas, there are 3.2 million lives in our Medicaid program. By 2014, that number will grow to 4.2 million. And 5 million or so will be added to the commercial rolls per this plan beginning in 2014. The total federal cost associated with this expansion of Medicaid over the 10 years is $120 billion. This is what I really want you to kind of get your heads wrapped around. Medicaid eligibility is made a function of the federal poverty limit or federal poverty line of income. In order to qualify for, if you were a parent, in order to qualify for Medicaid under Texas regulation, you can make no more than 26% of the federal poverty line. That's not very much money. That's abject poverty. This law brings that eligibility up to 133% of the federal poverty line, in line with most of the other states in the country. Now, I'm not saying that's a good thing or a bad thing. I'm just saying that we've had explosive growth in our population. We've had explosive growth in the demographic portion of that population that relies on Medicaid, and we've had a policy for years and years and years to be about the second lowest paying state in terms of covering that portion of our population. I'm making no value judgments about that except to say that that policy has had significant impact in this discussion.